Hello guys, this is Dr. Palaniappan Manickam. In this video, we have a special guest. Her name is Dr. Ramya Ponnuswamy. She is my colleague. We spent 5.5 years together at PHG Medical College, the best college ever in India. I can guarantee you that because Dr. Ramya Ponnuswamy was there, not me. So she is a practicing OBGYN, widespread clinical practitioner with the obstetrics and gynecology department with Kumaran Medical Center at Sati Road in Kudumpalayam in Coimbatore. So the reason I'm bringing her on the show is twofold. One is I taught her during house surgency, and then she became an OBGYN, and I became a YouTube doctor. And the second one is she has been so much patient with PCOS, and our whole channel was about like intermittent fasting, weight loss, and how weight loss is going to help PCOS. So I thought it'd be better I bring in a OBGYN specialist to discuss about this. Hi Ramya.
Hi.
Everybody build up balama irukka? So we graduated close to like 15 years ago. Yeah. So then, so now we have had different paths, and she is like a very leading practitioner in Coimbatore. And I think my paths have diverted into social media. I'm still a full-time gastroenterologist. I'm part-time
Clarification.
Clarification. So okay. So Ramya, so we talked about this multiple times before. So we said, okay, with the rapid, fast-paced environment, along with obesity, with all this nutrition and all obesity-related GI problem, the biggest thing that has been like going on is obesity-related OBGYN problem. And one of them is the big PCOS, right? So I always had this confusion, and I still don't know which comes first. It's because of obesity they get PCOS, or it's because they got PCOS for some reason and they get obesity. Educate me.
So one thing I need to clarify here is everyone thinks it's a disease. It's just a lifestyle. It's just a syndrome, which is very much a lifestyle thing. So it starts from the time you are actually born. So there's a small genetic component to it.
Okay.
But the triggers are which makes PCOS as bad as it sounds.
So you're telling that when a baby is born, there is some genetic component to it, if that baby is going to develop PCOS or not?
Not. The lifestyle is going to determine whether the child is going to develop PCOS or not.
So let's say there's a 1% chance of genetic. If the lifestyle contributes to it, then that patient will definitely develop PCOS.
PCOS. Now, when I say lifestyle, obesity is a major trigger.
I see.
So that is why obesity and PCOS is always connected together.
Okay.
It's not the only trigger, but the major trigger.
Okay. So educate me again. So the patient is genetically predisposed. Okay.
Yes.
But let's say that they are good in their lifestyle, so they don't develop obesity and they are proactive. What will happen to them?
Their chances of developing PCOS is less than 1%.
Even though they are genetically predisposed.
Predisposed. Yes. That's why it's a lifestyle disease.
I see. So maybe it is not a disease.
It's not a disease. That's what. I see patients who are like sad, depressed, that they have PCOS. There's nothing to be sad
about. Worry too much about.
Exactly. So that's where it starts. The thing is, it starts from the parents, how they educate them and the lifestyle they provide them. So it's a thing where they have to start a healthy lifestyle. So when they enter puberty, they are active, dynamic, and then as they grow older, that active lifestyle stays with them, and and PCOS isn't a problem. So that's
a very good point. So when the patient reaches puberty around like 12, 13 years of age, So let's say that the parents are healthy, the parents are active, the parents know about
Yes.
lifestyle changes. They teach the kid the good
Kid.
lifestyle changes.
Yes.
And even that kid is genetically predisposed to develop PCOS because the parents are making some good choices. That patient might not develop PCOS.
Definitely. They learn. They are good examples.
Wow. Nice. Wow. So it's a very tough question. Okay. If you don't want to answer, it's okay.
Okay, go
Okay.
ahead.
So you see these young people, right? Like 15,
Yeah.
16-year-old.
Yeah.
What is the percentage of parents who are obese who are bringing these kids?
See, when you look at it, actually it's 50-50.
50.
50-50. See, the 50% of the parents are actually healthy, but it's
Hmm.
peer pressure.
Ah.
She can eat a pizza and pasta, and she has a good life. Why can't I do that and still have a look good?
Wow. So the peer pressure of the kids surrounding them,
Yes,
and the
yes.
parents are okay with it.
So this
50%.
come because
Ah.
the child is sad and depressed because the peers are doing.
I see.
Uh,
I see.
so,
I see. I see.
so even if, so it's a 50-50.
I see.
Half of it is parents themselves are
And,
not an example.
ah.
Half of it is peer pressure.
I see. I see. So I think I'm a victim of that as well. Right? I'm a victim of that as well. 5 years ago, Arjun is 5 years old now. But that time when he was born, I was not this health conscious at all, even despite being a doctor. I was obese, as you know. As you know. As you
I've
know.
been looking at your videos.
As you know. So let's say that I have never followed this path. If Arjun eats a pizza, Arjun eats a pasta, Arjun eats a cold drink or soda, I would not think too much about it. I was like, okay, that's fine. No, that's how all the other kids are doing. And it's totally okay.
No, even if you know it's unhealthy, you tell Arjun. Arjun is not going to respect it too much because he sees you drinking Coke and.
Exactly. Exactly.
That's
So
what
let's,
happens.
so it is even more important if you have a girl child.
Yes, I wouldn't say that because the boy is going to get married and have a girl child at one point. So
Oh, no, don't take me wrong. What I'm saying is, it's even more important if you have a girl child because if that girl child is predisposed to develop PCOS, you could prevent a possible disaster right there.
you
Ah,
could prevent life where she is having issues with
issues.
her issues. I wouldn't say a disaster
Right, right.
where
I
she's
mean,
having issues with
disaster
her.
is that issues will turn into a disaster if it is not
Yeah,
taken care of.
yeah.
Nice,
So
nice. Super,
that trigger starts from there,
super,
from
super.
birth.
So, what is this deal about PCOS itself causing obesity?
um, it's not that way.
It's not that way.
So PCOS, it's a vicious cycle. You put
Mm.
on weight, the PCOS starts,
Mm.
and then because of the PCOS, then the hormones are all going up and down.
Mm.
Your insulin levels are going up because of your obesity,
Obesity.
hyperinsulinemia, and then you go put on more adipose tissue. So it's a
Mm.
vicious
So
cycle.
it's a vicious cycle. But the concept is that, hey, என்னோட பேஷண்ட்லாம் எனக்கு வந்து பிசிஓஎஸ் இருக்கு என்னால வெயிட்லாம் கம்மி பண்ண முடியாது டாக்டர் அவங்க வேற ஏதாவது சொல்லுங்க அப்படின்னு சொல்லிருக்காங்க.
Yes,
Right?
yeah.
Don't you think that's a very common misconception that PCOS causes obesity?
It's very common, very
Very
common,
common.
and it's easy because you have someone to blame.
Hmm. Correct. Correct. So they say,
Yes.
hey, no, I have PCOS. No matter how much or what I do, I'm not going to lose weight.
Right,
Tell me an
exactly.
alternate option.
Exactly. So that's the thing. But the thing is, as you reduce, I'll just give you one example. Usually, women, what happens is before they get married, they want to look good on the stage, so they start losing weight. So
Men
someone who
வந்து
has
men அப்படி கிடையாது.
men.
That's okay. Arrange marriage பண்ணி வச்சுட்டாங்க. ஒன்னும் பிரச்சனை இல்லை. வேற பொண்ணுக்கு வேற ஆப்ஷனே கிடையாது.
கேண்டிட் கேமரால அழகா இருக்கணும்ல. அதனால முன்னாடியே menstrual issues இருக்கும். But then they really put in the effort. They want to look beautiful. They reduce weight. And post marriage for the first 6 months, her periods are very regular. She's surprised and she's so happy. Marriage has made things better. But the real reason is the weight loss. And once after they have all this virundu, all the feast, ellam mudiyum bodhu, they put on all the weight that they lost.
மணமகன் மணமகள் விருந்து அதுதான் இருக்கிறதே.
Exactly. கம்மியாவும் சாப்பிட முடியாது,
கம்மியா சாப்பிட்டா கோச்சுக்குவாங்க. ஏன்டா என்னை வந்து இன்சல்ட் பண்றியா நீ? சித்தப்பா வீட்டுல நீ அவ்வளவு சாப்பிட்ட, பெரியப்பா வீட்டுல ஒரு சிக்கன் பேர் தர மாட்டேங்க.
கரெக்ட்.
I see. So okay. So let me just summarize this. So what you're saying is a patient, let's say a girl child is predisposed to PCOS, have menstrual issues around puberty. She puts on weight, and around the time of marriage, they want to look good, so they lose weight. The menstrual periods get regularized.
Exactly.
And they go back to their usual routine because it is not a lifestyle change. It was a triggering factor that they changed. And when they go to the usual lifestyle, the irregularities come back.
That comes back. So, and then they are worried.
And then they have say, okay, PCOS, I can lose weight. But they did before.
They did. That is it. And so that is a good thing, because now they know how to lose weight.
It's a good thing how to lose weight.
Yeah.
Okay.
Go ahead.
Okay, so let's take that same situation. So it became normalized. But PCOS patients they are at increased risk of infertility. Ovum olunga healthy-a varadhukana vaayippugal romba kammi. It's very less.
So the PCOS it's not about the quality of the egg.
Quality.
There is no issue with the quality of the egg.
So quality of the egg is good.
Mostly it's okay. The problem is the frequency of the ovulation. Ovulation is the time when the egg comes.
Okay.
So since they have irregular cycles, for someone who has regular cycles, she has 12 ovulations. For someone who has irregular, once a month.
So one egg per month.
Exactly. So irregular cycles, it's going to be lesser than that. So the probability of getting pregnant gets delayed.
So you have the good egg, but it is not getting released timely every month.
And even if it gets released, the hormonal imbalance is not letting it to implant. So in the uterus. So these are the factors, they get delayed.
I mean, the whole OBGYN thing is like so, it's so surprising that the God has created such a...
Exactly. Like it's like lot of gray areas.
Lot of things has to go right for a baby to be formed.
It's complete math. Like
so ovary-la ovum comes over, travels through the fallopian tube, gets implanted in the uterus. So what you're saying is that ovum is okay, it's good quality most of the times, but the release is not happening. And even if it is released, because of the hormonal imbalance, it is not getting implanted in the uterus for the fetus to grow.
Yes. So the environment, that we will say, environmental milieu. So that's great.
I see.
So that is why this is happening.
So fascinating. Wow. இது பரவாயில்லை, இந்த gastroenterology எவ்வளவு பரவாயில்லை. ஸ்டொமக் ஆசிட் வேற ஒண்ணும் இல்ல.
No, it's a lot of misconceptions, because when they come for the treatment, we call it subfertility. We don't call it infertility, because it's just it's not like the totally able to conceive.
Nice.
So subfertility is the thing is, they see the egg coming, then we say don't worry, and then it doesn't happen. They're disappointed. The egg came. Why? Because it's not only about the egg. There are other factors too.
I see. So இந்த ரிலீஸ் ஆயிருச்சு, ஆனா இம்ப்ளான்ட் ஆகல.
Exactly.
இது என்ன பேசிக்கா தமிழ் படம் மாதிரி இருக்கு. ரிலீஸ் ஆனி அது ஓடணும் போல. நல்லா இருந்தா ஓடும். So basically டைரக்டர் நல்லா இருக்கணும், மியூசிக் டைரக்டர் நல்லா இருக்கணும், கதை இருக்கணும், அப்பதான் ஓடும். அந்த மாதிரி எல்லா ஹார்மோனும் கரெக்டா இருக்கணும், அப்பதான் ஓடும். நம்ம லெஜெண்ட் சரவணன் சார் மாதிரி இருந்தா ரிலீஸ் ஆகும், ஆனா ஓடாது.
அது நம்ம
கையில இல்ல. ஆனா நம்ம எல்லாமே அந்த நம்ம கரெக்டான டைரக்டர் சூஸ் பண்ணி கரெக்டான மியூசிக் டைரக்டர் நம்ம ஏற்கனவே ரெடியா வச்சிருந்தோம்னா the film is success.
So the thing is, obesity, That is where we are standing here. Even when you're having a PCOS, even if the genetic component is stronger, and but you are not able to control your environmental obesity, when you will need treatment for in subfertility. But what actually happens, the results are better.
The outcome is better.
Outcome is better. Exactly. So even when you have a very strong genetic component, when you're not obese, when you go for treatment, the outcome is much better.
விதியை மதியால் வெல்லலாம்.
True. அதிங்கிறத விட
because vidhi is genetics, that's what you're born with.
Exactly.
But madhi means wisdom, so you can actually be proactive and then have a good increased metabolic rate. Don't be obese, and you can have good outcome.
Yeah, so true.
Seri, ipo adhe example of going back, that that girl got married and 6 months regular periods, and then went back to the lifestyle because she was obese and started having irregular periods, comes to you, have PCOS.
Yes.
You say weight loss, and then you obviously are going to say follow Dr. Pal channel.
Yes. Link to them.
அந்த சைடு மட்டும் போயிடாத, எங்க அந்த சைடு மட்டும். சரி, so let's say that okay, I'll just give you some numbers. Let's say they are 90 kilos. Okay. So you say that you lose weight, that overall that circadian rhythm, I'm sorry, the musical orchestra of all the hormones being released and implanted is going to go good. 90 kilo la irundhu 80 kilo வந்து கம்மி ஆயிடுச்சு. Okay. Regardless of whatever it is. When that happens, 90 to 80, or let's say like 10 to 20% of their baseline weight, you said that is good outcome, but what is the percentage? What is the probability?
Actually, a 5% weight loss is more than enough.
5% ரொம்ப கம்மி இல்ல?
கம்மி தான், but even 5% ல they see changes.
So 90 kilos 5%ங்கிறது வந்து எவ்வளவு? நீ சொல்லு.
4 கிலோ.
10% 9, 5% 4.5. So 90 minus 4.5 வந்து 86, 85.5 வந்தாலே போதும்.
They see changes. They start seeing the changes.
So when you say
that's what I'm trying to, it's not, I'm not saying it's enough, but they start seeing the changes. 5% of weight loss, they start seeing changes.
Wow. It's an amazing, la?
It is. And the problem happens is about the consistency. It's very difficult to maintain that loss.
Maintain the consistency. And also, this has been, running in my mind for a long time, la? So let's say that we also went through infertility issues and everything. So on the time period, the girl is getting blamed more than the guy.
Most of the time, yeah.
Most of the time,
most of the time, yes.
That guy might be obese like me.
True. Old pal, not new pal.
Yeah, exactly. Old pal. That's saying obese like me in the past. But the first thing is okay. Namma da vandu she is obese. It's a problem. But you're saying that even 5% of weight loss will definitely increase.
Show changes. They start to show changes.
சரி, இப்போ நீ வந்து weight loss ன்னு வந்து நீ உன் பேஷண்ட் ரெக்கமெண்ட் பண்றப்ப what do you say?
Actually, the truth is PCOS should be approached in an individualized manner. There's no blanket treatment for PCOS. You should know your body type.
சரி.
And see, running is not for everyone. Walking is not an exercise.
Thank you so much. The reason ஒரு Insta reel போடு. I know you don't have time to see.
No, I saw the walking. They walk so slow. Talking everything about everyone else. I don't even think they lose 10 calories.
They gain 10 calories because at the end they eat one masala vadai.
That happens. So I say, you are a young woman who has to be dynamic. Do not walk. There's no point.
Okay.
They wasted 1 hour of their precious time.
Exactly. Thank you. Exactly. The best bang of your buck is not going to come from walking.
Nothing happens
Because
with
everybody
walking.
is busy. They want to get the weight loss right away from the limited time they have.
Yes, true.
Sherry. Okay, you
So
say
they
no.
have
Okay,
to go for something as a combination of cardio
but
with
cardio,
weight
strength,
training.
weight training. Sherry. But as a OBGYN, right? As a
Yes,
OBGYN, you have so many patients to see.
true.
Yeah. How many patients you see in a day on average?
On average, 20 to 30.
30 patients a day. So yeah, 30 patients. 30, 20 to 30 patients are too much. I mean too much for US standards. US standards are சும்மா நான் கொஞ்சம் எக்ஸைட் பண்ணாலே ஐயோ எங்களால முடியாதுப்பா அப்படிமாங்க. So okay, let's say okay 30 patients வச்சுக்கோங்க. அதுவே lower end தான் I think so. And 30 patientsல வந்து ஒரு 10-15 minutes 30 minutes per day ஒரு per patient பேசுறப்ப you don't have time to go over all this in detail, right? So unless you inculcate the awareness that weight loss has to happen somehow to get better. So in that limited amount of time, you're going to say that, hey, cardio panna, strength panna, diet panna, whatever. Okay.
Yes.
So let's say that they go to somebody else or they follow by themselves. And then they come back to you and they say, I lost 5% of weight loss. I'm seeing changes now. Okay. I'm seeing my menstrual periods are getting regularized. Okay. Is my PCOS clear?
See, that's where we don't have to bother about PCOS at all. As long as you're, see, what is PCOS? It's irregular cycles and inability to naturally conceive at speculated time. So there's some criteria called the Rotterdam's criteria. And you have some skin changes, the hyperandrogen effects.
Yeah. So you check all the boxes.
Yeah, so that's the Rotterdam. So as long as none of this is happening, do not worry about the ultrasound report or what Google says.
அந்த கரு முட்டை அந்த என்ன சொல்றாங்க ஓவரியில முட்டை இருக்கிற கட்டி நீர் கட்டி
அந்த நீர் கட்டியை பத்தி
கவலைப்படாதீங்க. Exactly.
It mostly goes away. We don't have to do an ultrasound at all because PCOS is not an ultrasound diagnosis.
Okay.
With widespread availability of ultrasound, what is happening is there is more reporting of like this PCOS. Ultrasound should not carry the diagnosis of PCOS at all because it's not a sonography diagnosis.
The ultrasound say correlate clinically all the time. We should tell them, அது நாங்க பாத்துக்கிறோம். நீ சும்மா இருந்தாலே போதும்.
Radiologist நாளைக்கு எனக்கு பண்ணி கொடுக்க மாட்டாரு.
Correlate clinically. I think what is happening is even though that female has normal menstrual periods, they go ultrasound for something else like abdominal pain.
Exactly.
And then they have two things. One is fatty liver, okay, and the other one is PCOS. I'm here to tell you that if you have normal menstrual periods already, don't worry about PCOS, just worry about the fatty liver.
Exactly. But if she's having fatty liver, she's definitely having issues.
Exactly. So if you have fatty liver, then there will be some menstrual
there are definitely issues, yes.
So it's the other way around as well. Okay, so basically what you're saying is don't put too much weight on the neer katti or the cyst in the ovaries that much.
Exactly.
So, okay, focus more. Okay, sounds good. So what is your take on this the laparoscopy panni and the katti odaikiradhu?
Okay, that is and actually
I also read Google.
Google. There is no katti to break there. Anga kattiye illa anga odikkiradhukku.
But ultrasound says katti. You say no katti. Who should believe?
Because it's all small follicles, immature follicles. That is all. So one mature follicle will give one egg. What is happening? Everything is immature. Nothing is becoming mature. So once the hormones are right, technically when cycles come, only one follicle becomes mature. So all other follicles should die off. So that is how normal physiology works. Here what is happening, because of the hormone imbalance, all the immature follicles are active. It is not letting in one follicle become mature.
Single
வரணும்ங்கற single கெடுத்து ஓட்டுது.
So கூட்டமா வந்து இருக்கறனால அதுக்கே தெரியல எது வந்து லீடிங் follicle எது dominant follicle
It's
தெரியல.
not letting they are secreting too much hormones. It's not letting anything become mature. That is all.
இது வந்து I'm not sure that I can comment on this or not. In the US visa ஒரு 15 years ago when I wanted to do post graduation over here, அப்போ வந்து we used to go to this GRE TOEFL courses அதெல்லாம் வந்து போய் we used to write out. So there were so many ways to do this. அப்ப எல்லாத்தையும் வந்து கொஞ்சம் கொஞ்சம் பண்ணி கடைசில வந்து ஒண்ணு கூட பண்ணாம
ஐயோ அந்த கோர்ஸ் மிஸ் பண்ணிட்டேன் இந்த கோர்ஸ்
Exactly.
So that is what is happening. Too much hormone எல்லாம் too much வருதுங்க கடைசில எதுவுமே உருப்படறது இல்ல.
இது உருப்படறது இல்ல.
அவ்வளவுதான் இங்க PCOS.
So you need one follicle to be the dominant one and suppressing all the other follicles, and you should take your help of your body's hormones to do that.
Exactly. Everything is hormone controlled.
Seri. Appo if that is the case, what is your take on my promotion of circadian rhythm?
It's very important. It's very important. So because circadian rhythm triggers obesity. And the one
Thank you.
Because why I say this is I see a lot of people working in US time from India. So their whole lifestyle is they never see the sun. Yeah. So at a particular point, they do become obese. They do have a healthy lifestyle. They don't in the mornings they do eat a healthy food. They're not like binge eating. None of those happen. But yet they become obese.
Correct. I mean, it's very common. Also, so you see, how many percentage of patients that you see, obese PCOS patients, you think that they're not maintaining the circadian rhythm?
I would say only like 10 to 20%.
10 to 20%. Okay.
20%.
So, which means 1 in 5 patients, even though they are adopting healthy lifestyle, just because their circadian rhythm is in disarray.
Yes.
The hormonal imbalance kicks in so easily.
Very easily.
And all this, the beautiful, fascinating cycle that we talked about that God has given us is very easy to be disrupted. It has to be like a musical orchestra.
Exactly. The stress. So the next trigger after obesity is stress. So the stress triggers it.
I think our community வந்து, I mean, I feel so bad for her actually being a woman who is not conceiving within a year of pregnancy.
Oh, it's a big stressor.
So already there is this. I'm making பேசுறோம் மணமகள் விருந்து. And she's going into a new house, new thing, and then she needs to get adapted to this, and then she has to prioritize all the other stuff first.
Exactly.
Prioritize her.
You start questioning from the month they become married.
Engaged. Get married. Get married.
So from there on, the stress starts.
So whenever there is stress, there is a hormone called that is cortisol. That is created just for the audience. That cortisol suppresses all the other hormones. Cortisol is the mother of hormones. When cortisol, they're thinking that, okay, this guy is in danger. But this guy is not in danger. This guy is actually watching Vijay TV teleserial. அது பேர் என்ன பாக்கியலட்சுமியா? He's watching Bhagyalakshmi. She's watching, but the body doesn't know. Body doesn't know Bhagyalakshmi. So, then after 1 year, then they start showing to all these PCOS specialists like you, infertility specialists. Appa வந்து that stress slowly kicks in. When the cortisol is there is no way that you're going to get a good circadian rhythm and hormonal balance.
Right? No, very true. Yeah. It's all a vicious cycle. Ama.
So appo வந்து then you say okay, so let's say that unfortunately they are in the vicious cycle. Okay, they're trying to lose weight. You say that you do meditation, you decrease your cortisol, so don't worry about all the other chatter around.
Yes.
Okay, and then you're saying that it's going to get improved 5% weight loss and everything, and then one dominant follicle is released now. The likelihood of pregnancy, the probability of pregnancy for them within how many years?
In any cycle, in any natural cycle or a treatment taken cycle, the chance of conception is only 40%.
Even without PCOS?
Even without PCOS. It's only 40%.
So அப்போ வந்து 12 cycles a month இருக்கு.
That's
அதுலயே
so
வந்து
each
6
cycle is only 40%. So that why someone without PCOS becomes pregnant earlier? Because they have 6 consecutive cycles. So the cumulative rate is high.
I see.
Someone with PCOS, the cumulative rate is lower because they don't have
They don't
consecutive.
release. Oh my God.
That is all.
Okay. So then I think once it gets regularized, once the circadian rhythm comes in, the dominant follicle comes out, then it will become regular every consecutive.
Regular, exactly. Usually after the weight loss, after the stress relief and everything, 3 to 6 months we see results. But the problem is they want instant noodles results.
2-minute Maggie noodle result வேணும் உங்களுக்கு.
Weight loss ஆயிட்டேன் ஏன் இன்னும் pregnant ஆகல? Wait, you there is more time.
So again, that 5% weight loss, it might be okay for that particular patient, but sometimes it might need even more.
More, exactly. That is why I said it is an individualized, personalized approach for PCOS, and it doesn't work as a blanket. Go weight, lose weight. That doesn't work.
Is there any? Go ahead. I'm sorry.
Yeah, it is a more of a have a healthy lifestyle. It's because go lose weight is stress. Have a healthy lifestyle.
Exactly. Happiness. Thank you. Exactly. So that's why when any patient comes to me with fatty liver, what I first thing say is, don't go on this diet, don't go on that exercise, don't do this. Always don't think about what you shouldn't do. Think about what you can do. So think about, okay, the eating window that you can control. So you can just eat whatever you want, but it's that particular eating window. That is something relatively easy to do. So focus on what you can do within your lifestyle, within your environment, to modify accordingly so you can achieve the results.
Exactly. That's what.
So PCOS like பார்த்துக்கிட்டீங்கன்னா, so let's say, is there any medication that can increase the follicle?
So what we do in PCOS, we buy time. So someone is having heavy bleeding, or someone who's having bleeding for a long time, we give them hormonal based medications, so that they can we can control their problems for a short duration of time. So during that duration of time, if they are able to manage this lifestyle change, then they don't need a medication.
It's absolutely important to incorporate that during that
Exactly, because if she's going to suffer with menstrual problems, she's not going to be able to concentrate on the lifestyle.
But that is not the treatment.
No. There's no
medication
curing treatment.
By time. Okay, yeah. Go ahead.
There's nothing called a cure in PCOS. It's just a syndrome. You don't have to cure it.
Okay, let me ask you this. Let's say that best case scenario, every patient, every people follows my channel.
Okay. Okay. I wish scenario.
Everybody follows my channel, follows this eating window, lose belly fat, and everybody is within their normal body mass index. Is it reasonable to say that you will not have any patient with PCOS? Not that much.
No. We will still have PCOS because, as I told you initially, there is a genetic
component, but the percentage will be low.
Very much.
Very low. Okay, so let's say I'll ask you how many percent. So right now, 100% பார்க்குற.
Oh, it will become 5 to 10%.
Wow. So இது மாதிரி ஆச்சுன்னா only 10% தான் இருப்பாங்க PCOS patients.
PCOS.
Those are the real patients.
Exactly. Yeah. So it's more of the component, but there are methods. But obesity, the trigger gone itself 90% are going to be okay.
சரி, இப்போ வந்து weight loss பண்ணிட்டு there are certain number of patients who are really like genetically predisposed, obesity triggering factor, and then now they've removed the obesity. 75% of the time this patient will be doing okay, but 25% of the time there are some patients who might still have some problems with infertility and everything. இல்லையா? அவங்களுக்கு வந்து you recommend IVF மாதிரியா இல்ல வந்து what is it?
No. So PCO itself, you don't have to directly go for IVF, even women with PCO conceive naturally most of the time.
Most of the time.
The only problem is it takes years. So that is it. That is it. So now with all technology, they don't have to wait the years.
So what do you mean by that?
So what we do is we give medications to trigger the egg to come out.
I see. That's the clomiphene.
Clomiphene, exactly. So இப்பதான் படமே எடுக்கறாங்களா அப்புறம் என்ன
அப்படியா? So the clomid kudukrappa, what is happening is that the trapped follicle is released.
So basically clomiphene regulates the hormones and helps one dominant follicle come out.
One dominant follicle. And நம்ம ஏற்கனவே இந்த single அந்த analogy.
Exactly. That is what it does. So we can basically trigger the ovulation.
I see. Okay. Now I understood. So we want that singam to come out.
Yes.
Okay.
Singam to come out.
Singam to come out. Singakutti. That could be a female singakutti as well. So singam to coming out. And the singa வெளிய வரதுக்கு நிறைய barriers இருக்கு. அது one of the main thing is obesity.
True.
Okay. You take care of the obesity, that singam will come out. And the singam will come out ஆனாலும் you will have to have some other help in some patients. And அதுக்கு தான் medications.
That there are controllable and not uncontrollable factors. Weight is controllable.
It's correct.
Your hands.
Modifiable and all. Yeah, super. பாத்தியா இது யூடியூப்லயே இருந்தா இருக்கலாம். சிங்கக்குட்டி
Wow, medicine,
OBGYN, clomiphene.
But you're actually doing community medicine. So
community medicine, exactly.
Yeah, it's preventive medicine, which is very much essential for
much essential. Okay. Sounds good. So in the last few minutes of our discussion, I want to ask about misconception about PCOS. So in the Google doctors irukangala.
Yes.
So the Google patients வந்து use this floor to educate them so that they don't bother you.
Okay. So the first and foremost, don't be depressed about PCOS.
Okay.
It's just a lifestyle change. And take the initiative as soon as possible. Excuses don't help.
Example?
So they have a busy lifestyle. So there is no time for exercising. But there are priorities. You prioritize your exercise. So because the most common complaint is I don't have time.
But we have time for Bhagyalakshmi.
நான் பார்க்குற ஒரே சீரியல் டாக்டர்.
The Bhagyalakshmi series is also not helping. Even in Bhagyalakshmi, there's infertility, and the mamiyar is.
That's it.
And that series being watched both mamiyar and daughter-in-law at the same time.
And one other thing is, just because a friend had a child this year, you are not there is no pressure to have a child this year.
It's not a competition.
It's not a competition. You take it at your pace.
Okay, I'll ask you a question. It's very difficult to do that. I'll tell you. Okay. So I told you we have also some infertility issues initially. Now we are so blessed to have 2 kids. But before we had some infertility, all we get is baby shower invitations every time.
Yes, that's a stress.
That's a stress, right? That's a stress. அப்போ வந்து we're already stressed out. We're already doing all this, fasting. On the top of it, எப்படி வந்து it's a normal human response தானே?
True. That is what the thing is. With this age of technology, being childless is very, very less. Have faith on the system.
I see. You're saying,
Just
so
have
we will
faith on
get
the
there eventually.
eventually. So
Okay.
have faith on the future. So you reduce your stress.
I see. We just keep on saying ourselves, saying, but this is going to happen. It is. நம்ம வந்து மாட்டு வண்டியில போயிட்டு இருக்கோம்.
Exactly.
But we'll definitely reach the destination somehow.
That itself is going to reduce your stress.
Thank you. Yeah, that's a very good point. That's absolutely. So, but the peer pressure is going to be there. I mean, you can't say no to that.
Yeah, you see, as humans, we are not. It's not going to help in any way. But
Right.
then, there's something to pacify yourself.
Correct.
And
you
this
try
is
to educate your educate your peers and environment. You can change the environment.
So nowadays, there is family pressure. I agree. There are families who pressurize, but then I do see a shift where the women themselves pressurize individually. Just looking at the surroundings, just looking at the peers, and when the family stress and the peer stress joins together, then it's becoming
That's it.
It becomes more of a mental issue then.
Correct. ஏன்னா அந்த ட்ரிகர் நம்ம வெளிய எடுக்க ட்ரை பண்ணிட்டு இருக்கோம், obesity ட்ரிகர்.
Exactly.
அந்த obesity ட்ரிகர்க்கே இது எல்லாமே ட்ரிகரா இருக்கு.
என்ன நடக்குதுன்னா, they don't go out for functions because everyone at the function is asking them. So you're sitting at home, then snacks, then
again the same thing, stress, cortisol, Bhagyalakshmi.
And then the cycle continues.
சரி, அப்ப வந்து இப்ப வெளிய போறப்ப what do you say? Okay, when people are going to ask you, hey, உங்க கல்யாணம் ஆகி 2 வருஷம் ஆச்சு, என்ன குழந்தை இல்லையா?
We are at the process. Don't explain.
We are in the process.
When you don't explain, they stop asking.
ரொம்ப திமிருப்பா அவனுக்கு அப்படின்னு சொல்ற சான்ஸ் இருக்குல்ல?
பரவாயில்லை, that is better.
That is okay, because what is important is your family. Nobody is caring about their family.
Exactly.
So prioritize your family first.
Prioritize. You have to prioritize yourself. Weight loss is not happening in 1 month.
1 month.
If they are seen your videos, they would know. And there is a lot of fad treatments that go on about weight loss. We will give you so much of weight loss in so many months, and they all come for it. They take all these medications, these protein mixes, but the truth is, you just have to have a healthy lifestyle and a regular exercising schedule.
Absolutely.
And it's a lot of money that they pay for the weight loss programs, which need not be spent.
There is no shortcut.
There is no shortcut.
There's no shortcut, because I mean, how I look at this is, it is based on how much damage that we have done before to our body. Okay. So unfortunately, Nala, when I grew up, I didn't know anything about anything at all, lifestyle. Now there are so many resources installed, and you just educate yourself and you just follow upon. But the time taken to come back to normal is directly proportional to the amount of damage that you did before.
And how much dedication you are showing in the time. Yeah.
சரி, வெயிட் லாஸ்க்கு மட்டும் தான் இந்த மாதிரி வந்து ஃபேட் ட்ரீட்மென்ட் இருக்கா, or are you seeing people
PCOS there is treatment even for, so PCOS irukka, take this tablet. PCOS there is no tablet for PCOS. Just it's more of an physical and a mental well-being.
Seri, okay, because you touched on the mental well-being, I absolutely want to bring this point up that நான் எவ்வளவோ வீடியோ போட்டேன், ஓகேயா, but my favorite video is on meditation that I did released couple of usually வந்து நீயே பார்த்திருக்க ஒரு வீடியோ வந்து பண்ணி உனக்கெல்லாம் ஒரு 1 million views எப்பறா யாரா பார்த்தாங்கன்னு கேட்டிருக்கேனே இல்லையா? ஆனா ஸ்லீப் அண்ட் மெடிடேஷன் ஒரு வீடியோ போட்டேன், ஓகே. Combined together, there are only like 50,000 people who have watched it. Okay, which is a good. I mean, the reach is still there, the awareness is still there. But what I'm trying to say is, இது இட்லி சாப்பிடலாமா வேணாமா? Is rice good or bad?
I have observed is meditation is not for everyone. That is why I said the blanket treatment doesn't work.
I see.
I know people who cannot do meditation. So just telling them go meditate doesn't work.
That's not going to work. Absolutely not going to work. But the point is that has to be included in the treatment regimen, as one size doesn't fit on its own. It cannot. It has to be individualized. One thing for the stress factor that you mentioned, as you know, multiple research studies have shown that meditation decreases the cortisol level.
Yes.
Right? And decreases stress level. And then meditation le வந்து நிறைய aspects இருக்கு. So I think one thing that we are underestimating is the cortisol level and stress. And stress வந்து நம்ம வெளிய எடுக்க முடியாது. That is something that has to go well through.
Yeah.
You can modify the response of your body to stress by doing all the other sorts of things, which is including meditation.
Yeah.
So PCOS அது எப்படி ஒர்க் அவுட் நான் சொல்றேன் பாருங்க. அந்த when we talk about the obesity trigger, see, we talked about all the other peer pressure and everything, but the stress factor இருக்கிற வரைக்கும் nothing is going to happen.
No, see, the female hormones and the hormones produced the adrenals are similar.
Similar. In what way?
Go see a pharmacology textbook.
ஏமா அதுக்கு டைம் இல்ல தான் உன்னை வச்சு நான் பேசிட்டு இருக்கேன்.
ஃபார்முலா கேட்டுட்டு இருக்கேன்.
இல்ல இல்ல இன் வாட் வேடா எப்படி how are you saying it analogy அப்படி கேட்டேன்.
ஓகே. அந்த ஈஸ்ட்ரோஜன் எல்லாமே ஒரே சப்ஸ்ட்ரேட் தானே. Estrogen, progesterone.
So the common substrate is the adrenal. Oh, so you're saying that the cortisol is also forming the same.
So even if your progesterone and even if your female hormones are right on track, if your cortisol is high, you are triggering PCOS.
I see.
Because now the ovary thinks that's extra hormone because extra cortisol.
I see. Okay.
So stress, yes, stress is definitely a factor.
Right, Cherry. Okay. What are the other things that you should tell the audience, use this as a platform to your patients? Is there any other misconception out there?
Okay. Exercise. Cardio alone is not enough. So you need to do some form of muscle strengthening or muscle training because hyperinsulinemia is one problem reason for the PCOS.
Right.
So that is why I said it's not blanket treatment. So I have seen people who just do the cardio, but they don't see the results.
I see.
Once they start, yoga is all muscle training. So they start yoga or weights, like not big weights, like
just like it's 1 kilo, 2 kilo weight.
They see the changes. So when you say I've lost weight but nothing has happened, or some people say I'm not losing weight, I'm doing so much exercise. It's because you haven't understood.
Okay.
So there are so many tips available how to do it. So I'm not going to go into
absolutely. Yeah. I'll tell you the secret recipe of PCOS. Okay, you might not like it because you will not have any patients.
Go ahead.
The secret recipe is, I don't have research to prove it, but I'm telling you, 10-hour eating window. Okay. So you start at like 10 a.m., finish by 6 p.m. if you can, or at least 8 p.m., not more than that, okay? 10 a.m. to 8 p.m. maximum. If you can 6 p.m., it's even better. And then in that eating window, your carbohydrate should be 200 grams per day, not more than that.
Yes.
It's very difficult. And then the next thing is you lift weights for 30 minutes per day. That's it. There is
and you finish it with a 10-minute cardio.
10-minute cardio. That's it. Don't go for 1 hour walk.
No. And Zumba and those work also because it's basically they combine cardio.
They combine cardio. Zumba is good. Zumba இப்ப இது இந்த தாய் கிழவி பாட்டுக்கெல்லாம் Zumba இருக்கு.
Zumba.
தாய் கிழவி.
No. Why I am mentioning that is I find a group has motivation. Than to do it as an individual.
I see. Okay.
Yeah.
Super. Very nice.
And when they have women with similar complaints, the stress levels come down. They meet people in the Zumba classes.
I see.
So they know they are not alone in this struggle. They have other people who understand them.
And I think we should include the husbands in the struggle as well.
Oh, definitely. I actually asked the husbands to go join them as a couple.
As a
Like,
couple.
like if you're going to the gym, or you're going, or I see a lot of time, the man would be actually active and dynamic, and he has the time. The woman wouldn't have the time.
Correct. Because she's preparing the healthy food for him.
That's there. Yes, yes, true. So I think there should be a balance when it comes to the domestic work and doing things together, and then the exercise also doing together. The husband or the man definitely has a role.
I see. Well, I don't know. I have a new. We have put together an online weight loss program now. So அது இப்பதான் ஆரம்பிச்சிருக்கோம். 20 patients, but I want to focus.
You're going to put it like இதெல்லாம் பண்ணுங்க இந்த வாரம்.
And individualized care இருக்குல்ல, அந்த 6 pillar about what I've experienced. அதை வச்சு வந்து ஒரு 20 patientsக்கு வந்து I started. I don't have time. I mean, you will ask me how I'm doing all this. So not
நான் கேட்கவே மாட்டேன். You have your ways. I am one victim, so no.
So அதனால I asked them to email இப்போ new me அப்படின்னு ஒரு ப்ரோக்ராம் வச்சிருக்கோம், new me அப்படின்னு. So பியூட்டிஃபுல்லா தெரியுது. இட்ஸ் நாட் an one size fits all கிடையாது. இட்ஸ் இண்டிவிஜுவலைஸ் கேர் எல்லாம் தெரியுது. ஒவ்வொரு பேஷண்ட்டுக்கும் வந்து ஒண்ணு தேவைப்படுது. ஓகே, நான் சொன்ன மாதிரி வந்து இன்சாம்னியா இருந்துச்சுன்னா வந்து மெடிடேஷன் நாங்க ஃபோக்கஸ் பண்ணோம். அப்புறம் வந்து ஏற்கனவே லீன் ஃபேட்டி லிவர் இருக்காங்க. லீன் ஃபேட்டி லிவருக்கு வந்து we focus on the carbohydrate content. obese இருந்துச்சுன்னா வந்து we focus on eating window. அது மாதிரி வந்து every individual இருக்குல்ல, அந்த ப்ரோக்ராம்ல if they enroll as couple, the outcome is 100% success.
You don't have to cook twice.
You don't have to cook twice. நல்லா பாத்துட்டேன். I think
you can't see someone eating biryani and you can't sit and eat boiled vegetables.
Correct, exactly. Right in front of you வந்து பிரியாணி கட்டிட்டு இருக்கிறப்ப நம்ம எப்படி வந்து broccoli சாப்பிடுவோம்.
Boiled vegetables.
It's not sustainable. So I think absolutely, I think husband has to be involved for sure.
It works beautifully.
And I think we should give credit to the husbands as well, right? But konjam, I think we are little bit more.
Like off the record, they are very worried about their medical insurance.
Correct. But compared to before, things are changing as well. I mean, we are also taking care of, but not that much, but still room to improve, but definitely much better than
definitely. Like
okay, super.
I am in more of a rural than urban center, so no retro thoughts are yet to change. But I am definitely there are.
I see. When you worked in Chennai, it was maybe different.
It was different.
But I absolutely agree with you. There are multiple room to improve. நான் வந்து என்னோட ப்ரௌனி பாயிண்ட் ஸ்கோர் பண்ணிக்கிறேன். இல்ல ஹஸ்பண்ட பத்தி நம்ம பாஸ்டர் சொல்லி ப்ரௌனி பாயிண்ட் ஸ்கோர் பண்ணிக்கிறேன்னு சொல்றேன்.
நீங்க கொடுத்தாலும் இப்ப அந்த பொண்ணு அங்க அதான் பண்ணிட்டு இருக்குது. நீங்க உட்கார்ந்து யூடியூப் வீடியோ பண்ணிட்டு இருக்கீங்க.
அது இதுல கட் பண்ணிரு. இந்த 53 பாயிண்ட்ல இருந்து கட் பண்ணிரு.
ஐயோ ஆமா டெஃபினட்டா.
இந்த பொண்ணு சொல்றது வந்து அத போட்றத இல்ல அத பாத்துறோம். ஓகே sounds good. சரி ஓகே, நம்ம வந்து ஒரே ஒரு லாஸ்ட் கமெண்ட் வச்சு சொல்லி முடிப்போம். சரியா?
Yeah.
You have anything thought process on கொடுங்க. I'll give you some time to think about. So I'm going to ask you the question. Tell me one little advice to the PCOS patient that they can take to the lifestyle change. அப்படினு சொல்ல போறேன். Okay, think through it.
Okay, one thing.
Think through it, and then when you're ready, you tell me. I'll ask the question, and then we will wrap it up.
Okay.
நம்ம நிறைய பேசிட்டோம். அதையும் திருப்பி சொல்லுங்க.
Just a concise.
So இல்லாட்டி வந்து ஏதாவது ஒண்ணு மட்டும் சொன்னாலும்
PCOS is just a lifestyle modification process.
It's not a disease. அது cure அப்படி சொல்லிடுறேன்.
ஆமா. அப்படி முடிச்சிட்டுமா?
Okay, sounds good. Okay, Ramya, it was a wonderful discussion. It's beautiful. I learned a lot more. If you want to summarize with a one single thought process that my subscribers can take to them after listening to this podcast, what will you say?
Okay, PCOS is not a disease. It's just a lifestyle which needs some training. So just a discipline in your lifestyle is going to make a huge impact.
Nice.
So take it positive.
Take it positive.
And
then one thing that you said was the destination, you will reach there.
Yes.
Yeah.
And there are definitely good outcomes. The only thing is just work a bit towards
patience and discipline.
Patience. Yes.
Patience. So if you have patience and discipline, we will not have any patience.
You say it so seriously,
right? Nice. Super.
I'll be happy.
I'll be happy. Super. So wonderful discussion. Again, for my audience, Ramya is at Kumaran Medical Center at Sati Road in Coimbatore. Please look her up for OBGYN related questions. Again, thank you so much. It has been a wonderful discussion, Ramya. Thank you.
Thank you, Palaniappan, for this opportunity.
Thank you. Bye-bye.